going. That's good. Now, we just want to check that all our information, that we've got the right patient in the right bed. So if you could please tell me your full name and date of birth. So you're Arthur Crawford. Yeah, your birthday is 18th of the 8th, 1938. Perfect. Now I just want to check your MRN number. So I just want. Okay, Arthur, I can see here that you charted some eye drops for that left eye, for that ongoing infection to your left eye.
So we need to verify the medication order, making sure that it's a legal order so that we can administer the medication. So first thing that we need to check is that the patient name is here. So we know that it's Arthur Crawford. We need to have the date. So date is down here, and the time. We know that it's 8 o'clock. We also need to have the name of the medication in generic form, preferably. So that is written here. That's the generic form. We need to have the dose of the drug. We've got 2 drops. Frequency, BD, twice daily. We need to have the route, so we know it's going to the left eye, and we've got a signature of the person who's writing the medication order. So we've checked that this is a legal medication, so now we are able to administer the drug. So we know that we've got a legal order. So the next step that we need to do is to look up this medication in MIMS so that we can educate Arthur, gain informed consent, and also so that we can check that it's the correct dose and in indication and those sorts of things. So we can see here that it's the same medication as on the medication chart, chloramphenicol, which is just here. That's our generic name, and then this is the common name, Clorsig. A lot easier to say, so you may choose to use this when we're educating our patient. So Clorsig, we know that it's a topical ocular anti-infective preparation, which is perfect for his presentation. We can check, so what we're checking here is the uses. Good, it's a broad spectrum antibiotic which suits what we're using it for, so correct indication. The next thing we want to have a look at is obviously a bit on precautions, but the main things that we're looking at is our adverse reactions. So adverse reactions here, so there can be some local irritation or such as itching, burning, and we would explain these things to our patient before we get consent to administer. The next thing you want to have a look at is any information on doses. So adults and children greater than 2 years is 1 to 2 drops in the affected eye, which is exactly what has been charted. So we are okay to give it.
Now these are commonly called Clorsig. They can cause some itchy or burning sensation to the actual eye upon administration. Obviously, if any of those side effects happen, please let me know and we can fix them up straight away. I can see that you've had the eye drops at 8 o'clock this morning. Are you happy to have them again at 8 o'clock at 8 o'clock tonight, so right now? Yeah, perfect. Thank you. I'll just go get them ready. Perfect. So I just want to check your full name, date of birth again. So Arthur Crawford, perfect, 18th of the 8th, 1934. And your MRN is still 347821. Perfect. And you don't have any allergies. Wonderful. Hey Arthur, so first of all, we just want to have a look at that left eye of yours, if that's okay. So I'll just pop some gloves on. I want to make sure that that eye is nice and clean. Good, it looks good, no redness, not too bad. Perfect, so we can go ahead and give you those eye drops. I'll just go grab. So just going to do our 5 rights.
Checking that we've got the right patient. So we've got the name, MRN, and date of birth using our 3 identifiers, and we've done that at the bedside as well. Checking that we've got the right drug. So we've got our right medication here, and we're checking it against the med chart. So we're checking it against what's charted here. We're checking that we've got the right dose. So we know that it's been charted correctly from checking it in our MIMS. So it's 2 drops. We want to check that it's the right time. You can see here we've got our 8 o'clock clock, and it's here, hasn't been given at 8 o'clock. And we also want to check that it's the right root, so it's the left eye. And we've checked that with MIMS. It's an ocular preparation, and it also matches our indication for the infection in Arthur's left eye.
We're going to wash our hands, pop some gloves on. We've got our patient sitting in a nice comfortable position, and you can use just a small piece of gauze. It's just more comfortable for them to hold here. And we're wanting to drop the eyelid down and actually put our 2 drops into the bottom eyelid, into that little pocket that's created on the outer edge. Yep, so we're just holding above the eye, nice and gently, letting a drop form and administering, and then administering. And instructing your patient just to close their eye slowly and gently, and not to actually blink. Now, there can be some spillover, and that's where you can instruct your patient just to gently hold the gauze, not to actually push, but gently hold the gauze over their eye. Can do that for up to 2 minutes afterwards. It's more of just a comfort thing. So there we go, we've given you your eye drops. Mr. Crawford, we've given you your eye drops now. Any stinging or burning sensation? No, all good? Perfect. I'll just give you your nurse call bell. Should you experience any of those symptoms or need me for anything else, just give that a buzz.